It's at 8 o'clock on a Saturday morning. She was laying on the bathroom floor, kind of all curled up, and that's when I noticed her speech was getting really hard to understand. And then I knew she was having a stroke.
When she first came into the hospital, our emergency doctors immediately found that she was having difficulty. The entire left side of her body was weak. She wasn't able to look to the left side.
So when somebody comes into the emergency room with stroke symptoms, the time frame is important because we're able to provide them with IV blood thinning medication, which is also called IV TPA. And that's been the standard of care for many, many years. What has changed is that we're now doing interventional procedures called thrombectomy.
In this case, we gain access to the blood vascular system through the groin. Much like a cardiac catheterization, we catheterize the blood vessels that go to the brain. This allows us to move rapidly from the patient entering the hospital to the interventional suite and then getting the clot out, what we call revascularization time, in times less than 1 hour.
After they did the surgery on her, and I actually could see the shape of her mouth starting to come back, her hands are starting to get, back to normal again, and it was just like, just a flower blooming.
She's doing really well. When we initially did our testing, we had some concerns about return to work and driving, both in terms of processing speed, problem solving, and attention. Jill's made great improvements in all of those areas, and hopefully next week she'll be returning to work part-time, in addition to driving there as well. So great improvements overall.
My memory's gotten better. I'm not as scattered as I used to be. I walk and talk just fine.